Blunt force trauma is a serious injury to the body caused by an object or force striking or piercing the skin. It can affect many vital organs and structures in the chest, abdomen, head, and limbs. Blunt force trauma can result from motor vehicle collisions, falls, assaults, sports injuries, and other causes. How can we prevent blunt force trauma injuries? Prevention is always better than cure, so here are some tips to avoid or reduce the risk of blunt force trauma. Wear a seatbelt when driving or riding in a car. Seatbelts can prevent you from being ejected or hitting the dashboard or steering wheel in a crash. They can also reduce the risk of blunt aortic injury, which is a life-threatening tear in the main artery of the body. Wear a helmet when riding a bike, motorcycle, skateboard, or scooter. Helmets can protect your head and brain from serious injury if you fall or collide with something. Wear protective gear when playing sports or doing activities that involve physical contact or risk of falling. This may include pads, gloves, goggles, mouthguards, and shin guards. Avoid alcohol and drugs and driving or doing any activity that requires attention and coordination. Alcohol and drugs can impair your judgment, reaction time, and balance, making you more likely to crash or injure yourself. Follow the rules and regulations of the road and the sport. Obey traffic signs and signals, drive within the speed limit, and avoid distractions like texting or talking on the phone. Respect the referees, coaches, and other players, and play fair and safe. How can we treat blunt force trauma injuries? Treatment of blunt force trauma injuries depends on the type and severity of the injury, as well as the patient's condition and medical history. Treatment may involve non-operative measures or surgical intervention, as appropriate. Here are some general steps for treating blunt force trauma injuries. Call 911 or seek emergency medical help if you or someone else has signs of a serious injury, such as severe pain, bleeding, difficulty breathing, loss of consciousness, or shock. Perform basic first aid if you are trained and able to do so safely. This may include applying pressure to stop bleeding, cleaning and dressing wounds, immobilizing injured limbs, and performing CPR if needed. Do not move the injured person unless they are in immediate danger. Moving them may worsen their injury or cause spinal cord damage. Do not remove any objects that are embedded in the body. This may cause more bleeding or damage to vital organs. Do not give the injured person anything to eat or drink unless instructed by a medical professional. This may interfere with their treatment or surgery. Follow the instructions of the emergency responders and medical staff. They will assess the injury and provide appropriate care. This may include fluid replacement, wound cleaning, infection control, nutrition support, pain relief, imaging tests, blood tests, surgery, and other procedures. Seek follow-up care as recommended by your doctor. You may need to take medications, do physical therapy, attend counseling, or have regular checkups to monitor your recovery. Blunt force trauma injuries can be devastating and life-threatening. However, with proper prevention and treatment, many patients can survive and recover from their injuries. Remember to always be careful and seek help when needed.